The National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
It has been called the virus, high five, the bug, the deadliest catch, and the gay cancer. But you may know it best by its most commonly used name, AIDS.
June 1981. 5 men die in Los Angeles of a peculiar pneumonia that left them looking like Holocaust survivors.
By the end of that same year, 270 men, primarily in New York and California, were diagnosed with the same unusual disease. 121 of them died by the end of December.
In June of 1982, doctors were concluding that the immune deficiency disease was primarily present in sexually active gay men. By the next month, doctors in Miami found the same disease present in Haitian hemophiliacs and people who inject drugs.
The Center for Disease Control named the syndrome AIDS, or Acquired Immunodeficiency Syndrome, in September of 1982. AIDS originates from the human immunodeficiency virus, or HIV, which severely weakens a person's immune system by attacking white blood cells called helper T cells. Over time, opportunistic infections, aka OIs, including cancer, fungal infections, parasites, and viral infections, take advantage of the weakened immune system. Once a person has an OI, that person is considered to have AIDS. It usually takes about 10 years for a person to develop AIDS if they do not have any treatment. In stage 1 of HIV, 2 to 4 weeks after infection, patients experience flu-like symptoms that may last for weeks. When patients first contract the virus, they are extremely contagious due to the large amounts of the virus in their blood. In stage 2, it's called asymptomatic HIV infection, in which the patients still have active HIV, but the symptoms are dormant, and the virus reproduces at a slower rate than in stage 1. In stage 3, when patients develop AIDS, immune systems are so severely compromised that any illness they contract will give them a high risk of death. Patients who develop AIDS on average only live about 3 more years. Tests used to determine HIV include ELISA, or enzyme-linked immunosorbent assay. This is the most common way to test if a person has HIV. During the test, HIV-1 is grown on cultures of human cells and antigens are removed from it. Antigens are substances that react with antibodies or cells that push away harmful cells. A sample of a person's blood is tested over a period of an hour with those antigens. If the patient's blood has antigens that bind to the cultured HIV antigen, they form a color that indicates if the person is HIV positive.
One of the most asked questions about the AIDS epidemic is, how did it start?
No one knows for certain how HIV or AIDS began. One theory is that the virus has continued for centuries in small African villages without being identified. Another theory is that HIV came from SIV, or simian immunodeficiency virus, found in a certain type of monkey, and jumped the species barrier in between the period of 1884 to 1924 in what is now the Democratic Republic of the Congo. The earliest documented case of HIV was in 1959 from Central Africa, and from African epidemiologists who believed that HIV spread to the United States during the mid-1970s. While doctors were trying to trace the origin of HIV, journalist Randy Schultz found a man that was at least partially responsible for the spread of the disease to the United States. HIV-positive French-Canadian flight attendant Gaëtan Dugas, also known as Patient Zero, was connected to at least 40 of the first 248 AIDS deaths in the United States. Dugas admitted that he had had at least 2,500 sexual encounters with American men, but continued to be sexually active until his death from AIDS in 1984. By 1980, however, HIV had already spread to Europe, Asia, Australia, the Americas, and the rest of Africa. In 1981, 5 previously healthy young men died from a rare lung infection called pneumocystitis carinii pneumonia, or PCP, quite a tongue twister, which was also later detected in people who injected drugs. That same year, groups of men in New York and California died from a cancer called Kaposi sarcoma. By the end of 1981, 270 cases of severe immune deficiency among gay men were reported, and 121 of those documented had died. Since the majority of the people dying from AIDS were gay men, the disease was named Gay-Related Immune Deficiency, or GRID, in the summer of 1982. After discussing that the disease existed in hemophiliacs and Haitians, the CDC officially called it AIDS in that following September.
impact on the gay community was devastating. After AIDS was spreading primarily amongst gay men, the disease was marked as the gay plague. About 12,000 AIDS-related deaths had occurred by the end of 1986, but the government was barely doing anything for education or preventative methods. People started to relate all gay people to being disease-ridden, which just made the public more homophobic. Given the homophobic attitude of the government and the public, a gay rights activist named Larry Kramer gathered a group of 300 members of the lesbian and gay community in New York and began a movement called the AIDS Coalition to Unleash Power, or ACT UP. This movement pushed to improve medical and social services for people who have HIV/AIDS. They also hoped to remove the stigma related to the disease as much as possible. ACT UP did this by nonviolent protests, targeted demands, and poster campaigns in urban metropolises that had large gay communities, such as LA and New York. Many ACT UP protests were held at Wall Street in order to target pharmaceutical companies who were profiteering from selling HIV drugs. They also targeted the FDA for its slow approval of drugs and the Catholic Church for its anti-gay and anti-abortion policies. ACT UP hosted the March for Lesbian and Gay Rights in Washington, D.C. in October of 1987 to demand the Reagan administration to take action against HIV/AIDS. By 1990, the New York branch of ACT UP had begun a needle exchange program to prevent the spread of HIV through dirty needles among drug users. Another activist organization, Gay Men's Health Crisis, also opened in Manhattan. They helped fundraisers for AIDS research and AIDS discrimination lawsuits and litigation, and handed out medical pamphlets and guidelines. Due to such protests, by 1989, HIV drugs became more accessible.
I had already been diagnosed in San Francisco with GRID, so all of a sudden the New York Times starts publishing there's GRID, and they're looking for what's causing it. And so everybody starts paying a lot of attention to the news, clearly. And then they discover HIV, and then they come up with the word AIDS. Mm-hmm. The only good thing that came out of that is we had something to anchor on and throw our hat on. So what happened immediately was, there was a lot of people didn't have health insurance. It sounds crazy, but people in their 20s that are going out to bars or whatever, I mean, they were healthy. They didn't really need health insurance. And so that was the first issue. We got social workers. We started raising money. We started the AIDS Walk in New York. And then that quickly went across the country to San Francisco, LA, Chicago, and now it's pretty much nationwide. This was in the beginning. There was no government funds yet. There was only money that you could get donated or raised. In New York City, we had Broadway Cares because so many of the people that work in Broadway were dying. And so, what is her name? One of the actresses started Broadway Cares, and because I work in the entertainment industry, I got involved in that, and we started putting on shows that just did nothing but Broadway Cares started an organization called Friends Indeed in New York, which was for people that knew somebody, not necessarily for people with AIDS, but for families. Like in some cases, back then, they would be finding out their son is gay while he's dying. And so people needed a lot of psychological help. And so where I was an activist is I used my power in the entertainment industry to get involved. And I'm a good deal maker, so I would put deals together. I didn't answer phones necessarily, but a lot of people did do that. I didn't do too much with patients. But I was involved that way in the beginning. Then later, the pharmaceutical companies started getting involved, and they needed to be regulated somehow. They were out of control. And it's still out of control, but we at least developed like a publicity. I mean, yes, I got involved in like helping identify needs.
I was a middle schooler in the 1980s, and one of the things that took me back was when I reflect back now, is how people perceived the transmission of AIDS. People didn't understand that it was a blood-borne virus, or at least that's how it was taught to us. People thought you could, get AIDS just from proximity to people, and they didn't understand who was carrying the disease. So as often if someone were thought that they were acting effeminately or thought to be homosexual, that you would get AIDS from them, and it wasn't understood or explained very well in the larger media. The second piece that really kind of stuck out at that time, and I remember and reflect back on and think is ridiculous, is the way the teachers and so on, that whenever they did have to teach it to us, didn't really seem to understand it. It was usually movies, and some of those movies we look back now and realize that they are also rather inappropriate or homophobic even.
President Reagan and the Reagan administration had a slow and questionable response to HIV and AIDS. It wasn't until 1985, when Hollywood actor Rock Hudson, who was a friend of Reagan's, died of AIDS in October of that year, did the administration finally start asking more questions about the disease. In 1986, Reagan asked the Surgeon General to start reporting on the terrifying disease. Reagan then deigned to ignore his wife about endorsing condoms. In 1987, when Reagan was to make a speech to the American Foundation for AIDS Research, he made his staff get rid of any mention of Ryan White in his speech, who was a teenager with hemophilia who contracted AIDS from a blood-clotting agent. But a couple months later, Reagan established a presidential commission dedicated to researching HIV and AIDS and to find solutions to the problems that the disease has produced. Yet in 1988, when the commission had finished the report of the disease, Reagan shelved the report until White House staff had properly studied it. By this time, all HIV-infected travelers and immigrants were barred from entering the United States. The FDA's commissioner at the time, Frank Young, knew that the public and health community was concerned about the policy surrounding HIV and AIDS. So during a speech that he made in 1987 at a conference at the Institute of Medicine, he spoke about how AIDS had brought up the issue of compassionate use of experimental drugs. Patients with AIDS wanted to try any new experimental drug, no matter if it had been passed by the FDA. When Young stated that he was stating that the FDA was allowed more compassionate access to certain drugs due to the amount of deaths that had already occurred. AZT was used as a cancer treatment in the 1960s and had languished in obscurity until Burroughs Wellcome, a major drug company, opened its considerable drug inventory for testing. In 1985, Burroughs Wellcome filed a customary new drug application NDA for AZT, at which point the FDA's regulatory posture became integral to the swift development of the drug. By the end of the decade, government acknowledgement and involvement of AIDS had been at least partially achieved with the passing of the Ryan White Act. White faced discrimination when trying to continue his schooling in his Indiana community, and gained national attention while trying to fight for his right to attend school. White died in April of 1990, 1 month before his high school graduation. And in August 1990, Congress passed the Ryan White Comprehensive AIDS Resources Emergency, or CARE Act, which authorized $881 million for emergency relief to cities most affected by AIDS. However, Congress only appropriated $350 million. Later that year, the Americans with Disabilities Act passed and included HIV as a disability that could not be discriminated against. That did not apply to the ban on HIV-positive visitors and immigrants entering the U.S., which was formally lifted by President Obama in 2009.
AIDS is still an ongoing disease, and people still have it to this day. It's not as severe and detrimental to mass populations in the United States due to medical advancements, but the dangers are still present. In Africa, AIDS runs rampant in villages, killing hundreds of people each day. There's still stigma surrounding HIV and AIDS, and common public misconceptions about who can contract the disease and how still remain. Even though this documentary focuses on the AIDS crisis of the 1980s, AIDS has never disappeared.
Thank you for listening. We'd like to thank Ms. Galvin for being an amazing teacher, all the teachers who provided such useful information, and our anonymous source for giving us his time and providing us with the interview. Thank you.